All right. Thank you, everybody, for coming. Thanks for joining us today. I'm Representative Mary Franson, and I am the Republican lead on the House Early Childhood Division. We're here today to discuss a comprehensive proposal to crack down on fraud in our public programs with an emphasis on the Child Care Assistance Program. Our proposal is 45 pages long and will be introduced later today at this afternoon's floor session. In total, it includes nearly 50 individual provisions, some of which these bills have already been introduced, and some are brand new pieces of legislation. The ideas in this bill are bipartisan. More than a dozen provisions are from bills introduced by Democrats. The package we're unveiling today has 5 key goals. Increase consequences for committing fraud. It is clear that existing penalties are insufficient and are not serving a deterrent for those seeking to defraud the Minnesota taxpayer. Our bill increases penalties and consequences for committing fraud and sends a strong message that we will not tolerate this behavior any longer. Provider controls. The legislative audit report and our fraud investigators at the OIG have made clear that more investigators is not the key to rooting out fraud. We need better controls on the front end to prevent fraud from occurring in the first place. Simply put, it is too easy for those who want to too easy for those who want to do wrong to defraud the Minnesota taxpayer. Third, investigations and prosecutions. Our bill gives additional tools to investigators to aid their investigations and to prosecutors to ensure fraudsters are brought to justice. 4, eligibility reforms. This bill eliminates eligibility for those found to have committed fraud, requires enhanced eligibility checks from DHS, and directs savings from eligibility checks to the Healthcare Access Fund. 5, oversight. The OLA recommended that the Office of Inspector Generals become an independent entity. Our bill includes that recommendation. If we do nothing else this session, we should listen to our nonpartisan OLA and implement this change. You have in front of you a list of provisions included for each section. Some fall under multiple sections. We want to highlight just some of the provisions for you. Our bill makes it explicitly a misdemeanor and adds financial penalties for the Child Care Assistance Program providers and recipients who make false statements during an investigation. Our bill makes it explicitly a misdemeanor and adds financial penalties for the CCAP providers and recipients who fail to provide access to records or facilities during an investigation. Our bill establishes that fraudulent providers automatically lose their parent aware rating. Our bill gives the DHS Commission power to suspend, revoke a license if a license holder is excluded from other DHS programs for fraud. This is a provision that is included in Representative Rena Moran's House File 2060. Our bill also compels the commissioner to immediately temporarily suspend a license if a provider fails to comply with a fraud investigation or is criminally charged with a fraud. This is another provision by Representative Moran in her House File 2060. We're making a number of changes for providers that will aid investigators in catching bad actors and prosecuting those suspected of fraud. This will help us catch fraud on the front end rather than relying on tips. Our bill requires a surety bond for centers who receive more than $250,000 in CCAP funds a year. Our bill strengthens the esthetician requirements. Years ago, Minute removed language from forms that made it easier to prosecute fraudsters. We put language on every form that makes it clear that documents are signed under oath and explicitly mentions perjury, so no one is unclear on the consequences of signing a false attendance sheet. Our bill requires that attendance records be legible, accurate, and provided immediately upon request, and that records produced after the fact are inadmissible. Providers are already required to keep daily attendance records, so this simply tightens up that requirement. Finally, we strengthen the link between licensors and fraud investigators by making licensors mandatory reporters who must report suspicion of fraud as they are conducting licensing visits. Now I'm going to turn it over to Representative Zerwas to discuss additional changes in the bill. Thank you.
Good afternoon. Thanks everyone for being here today. I'm Nick Zerwas, State Representative, represent Elk River, Big Lake, in House District 30A. I'm going to talk about some of the remaining provisions within the bill. Our bill permanently disqualifies providers convicted of child care assistance fraud from future eligibility. We were shocked when we first started examining this issue that providers could have multiple chances once they've been convicted of already defrauding Minnesota taxpayers. We make a number of changes that were originally authored by Representative Peggy Scott related to income and other eligibility determinations. Many of these would apply well beyond child care assistance program and help enhance eligibility checks for multiple public programs, as we've had report after report of issues where the state is incapable of correctly determining eligibility determinations. One of the biggest proposals we're making in this bill is a requirement for the Department of Human Services to enter into a revenue sharing contract with the help of a third-party outside vendor that will conduct eligibility checks across all public programs. Any savings identified would automatically go back into the Healthcare Access Fund, and that will help maintain the viability of that fund and capture that money back for specific healthcare uses. We have seen time and time again that the OLA, after review, has found the discrepancy of folks that are enrolled in public programs versus when you dig in to their actual incomes and their actual eligibility. We've seen error rates north of 20%, with hundreds of millions of dollars going towards individuals that don't meet the base qualifications for the programs that they're enrolled in. Finally, as Are
you talking about strictly the child care or
across all programs?
Okay.
Across all HHS programs. Finally, as Representative Franson mentioned, we have her proposal to establish independence for the Office of the Inspector General, removing that office outside the Department of Human Services. I find it outrageous that our current Inspector General reports up to the very leadership that they are supposed to be overseeing. We would not allow this to happen in any other scenario. We need an entity similar to the OLA with complete independence and autonomy and has the tools necessary to root out waste, fraud, and abuse. Unfortunately, Democrats in the Minnesota House have heard very few bills so far this legislative session, with 19 early childhood education committee hearings having been held. Only one, the last one, did they move forward and actually request to hear from the Department of Human Service around fraud. And in that, they still are yet to hear the reports and the results from the legislative auditor and his audit. And so clearly, up to this point, they are not taking this issue seriously. As the Democrats roll out their budget targets this afternoon, we urge you to press them on what their plans are to reduce fraud in our public programs. Why, with $1 billion surplus and hundreds of millions of dollars across all public programs in the Department of Human Services over the last several years, going to people that don't meet the requirements, why would Democrats expect Minnesota taxpayers to pull out their wallet and fork over more of their hard-earned money? This is an issue causing outrage from the public, and we are demanding that they show the public they are taking this issue seriously and not ask Minnesotans to pay more until they can demonstrate that they're at least trying to root out fraud within the system. We will continue to push them on this and expect to see serious fraud prevention measures included in any budget bills that are brought to the floor. With that, we're willing to take any questions you have at this time.
Tell me how this thing would work where you limit the number of slots somebody can have if they have employees of the children working there? How does that work?
Yep. So one of the biggest areas of concern that investigators have identified is the idea that individuals come in and are recruited by child care centers that have children that then enroll their children in the program. Those arrangements have been a source of considerable amount of suspicious and fraudulent activity. The threshold used to be at 50%. It was lowered to 25%. We propose to lower it even further to try to ratchet down on this opportunity for fraud. So we bring it down to 10 children, and then an opportunity, 10% of the children in the facility. And so our hope is that by ratcheting that down, that we can help control the opportunities for fraudulent activity.
What about the level of training? Because that was another issue that was brought up, that they had either not supplied the documentation for training or submitted fraudulent documentation.
The providers? Yep, and so clearly, we're gonna make sure, we need to make sure that there is enough training opportunities. What we've understood from reading through the report of the OLA and talking to the investigators, that a lot of it is that individuals don't have their attendance sheets available for inspection upon request. And so that's why we're putting in very clearly that upon inspection, or for a request for inspection, that those sheets must be immediately available for review, and will not be eligible if those sheets are brought forward in an administrative hearing or an appeals process 30, 60, 90 days later. You have a tight window at the time of inspection, and if your sheets, your attendance sheets, are incomplete or not available, they will not be included in the evidence that you'll be able to present that you're following the law.
Why haven't you gone to electronic sign-in sheets? That's what a lot of the investigators recommended.
Yep, so this is baby steps, and so we're working through what we think we can roll out. Electronic steps and other verification ideas are some of the ideas. We're pushing forward with a lot of those ideas. I think the idea of requiring every provider to acquire a new electronic system, we're concerned about the costs that could come along with that. And so we want to make sure that we are covering our bases and putting that statement back on to make it as clear as possible that fraudulently signing these forms are in fact a violation of state law, and to make sure that the forms are immediately available upon request.
What about the backfilling that they do? Do any of your proposals address that?
Yep, they're within the proposal to try to limit and cut down their ability for backbilling.
To what? Because I think it's 6 months now.
I think we bring it back down to 30 days.
Okay.
Do you have any money for BCA? There was a report that there was a bottleneck in the investigation, that things would be done by the Inspector General and those investigators, and then they would get into BCA and they didn't have enough people to process them. I don't see any money for BCA.
I don't believe we have any money in the BCA at this time for this proposal.
Why the insistence on an outside contractor? The agency has its own investigative unit dedicated to this. Do they really need an outside contractor as well?
Well, I think when you look across the board at public program fraud and eligibility fraud, I think what I've seen in my 7 years of of being here is I've seen year after year after year with the OLA and other folks raising the red flag and ringing the alarm that we are providing benefits from the Department of Human Services to individuals that don't meet the base elements for eligibility qualification. And quite frankly, even though the audits keep showing this, the federal audits show this, the state audits show this, the Office of the Legislative Auditors, independent audits show this discrepancy, time and time again, leadership within the Department of Human Services discounts that discrepancy and minimizes the fraud. We've seen ranges well into what would equate to hundreds of millions of dollars annually in ineligible people being provided benefits at taxpayer costs. And 6 years into it, there just seems no interest to find this fraud. As example, this legislature, House, Senate, and signed into law by Governor Dayton 3 years ago, put into account that the Department of Human Services needed to do periodic data matching to look at what someone fills out as their claimed income versus what they report through the Department of Revenue as their actual income. Just last month, that was implemented. 3 years later, despite the Office of Management and Budget, quarter after quarter, listing the amount of money that were being spent on those that the Office of Minnesota Management and Budget believed were not eligible. So clearly, the department does not take waste, fraud, and abuse seriously. Thus, we need to bring in an outside vendor. This is an approach that's worked extremely well in multiple other states, including Illinois and Wisconsin, where you bring in a third-party private vendor. There's some cost sharing or revenue sharing that goes involved, but the bulk of the money goes back and is returned, in this case, to the Healthcare Access Fund to provide care to folks that need it.
Representative, it seems like the finger is being pointed back at the Dayton administration primarily. Do you see any improvement in the situation with Governor Walz?
Well, I don't think we've had an opportunity to ferret that out. I think to what degree the Walz administration is serious about waste, fraud, and abuse will be determined in how he receives these proposals. Coming forward and suggesting that the CCAP investigators and folks within the Office of the Inspector General need sensitivity training, that isn't a serious proposal. That, to me, says that he isn't taking this issue seriously. If the Walz administration is serious about mitigating and cracking down on waste, fraud, and abuse, he will support the proposals we've laid forward here in this bill. So I guess we'll wait and see. I think one of the proposals that Representative Franson highlighted that's really key to all this is the independence and autonomy of the Inspector General. I fully expect Governor Walz to endorse and support this idea. In fact, when Governor Walz was Congressman Walz and he was following up on concerns within the Veterans Administration, he himself railed on the fact that the Inspector General within the Veterans Administration was being pressured by the administration higher-ups within the VA. And so he asked for independence of the federal Inspector General within the Veterans Administration. So he is very familiar with the idea that sometimes these Inspector Generals get pressure from their higher-ups. In his time in Congress, he asked for that autonomy and independence for the Inspector General in the Veterans Administration. So if it's good enough for the Inspector General's office in the VA, I assume it's exactly what he would want as governor, to have that autonomy for the Inspector General's office within the Department of Human Services here in Minnesota.
Mr. Representative Franson, a question.
Yeah.
The administration has come in with a handful, I'm not sure how they've totally broken them up, but there is a package that they have come in with. Deputy Commissioner Johnson presented it last week, Pinto presented last week. Can you just comment on how you think those would work? Do you think, obviously you don't think they're sufficient because you have a lot more, but can you just maybe talk about your reaction to their proposals?
Well, I think I will talk about the reaction the taxpayers have had. Fox 9 did a report or an article and a news story on the Walls proposals. And that was, I think, posted, Theo, was that posted, what, last Thursday? Yeah, about Thursday. And the taxpayers want tax sensitivity training. They want their tax dollars spent appropriately. The comments on that story were rather alarming. I think the Walls administration should take a look and see exactly what Minnesotans are saying about his proposals on fraud. But taxpayers are paying attention. That is the number one issue that when I go home and any of my colleagues go home, they're wondering, what are you doing to stop the fraud, not only in the child care assistance program, but in the public programs all around? This is a high tax state. Minnesotans expect their potholes to be filled, and they also expect that their public dollars be spent appropriately when going toward those that need a hand up in our public arena.
None of those proposals are worth considering?
The ones that I found was rather alarming was instead of really addressing the root, he wants the sensitivity training for the investigators and for the licensors across the state.
At the same time, there's a lot in that bill that I think addresses some of these same issues. For instance, the attendance reporting, you'd have to furnish that immediately upon
Yes.
request. So how much of the Walls proposal being carried by Dave Pinto are you supporting?
Well, I think you see in our package, we have a bipartisan bills included within that, but we're hoping to be part of the conversation. Us, the House Republicans are hoping to be part of that conversation. This is an issue that we have been following since the story broke on the fraud in the child care assistance program. And, you know, we have ideas as well. And so, fraud is, it happens in all areas of our government, and in order to address it, I think we need a bipartisan approach.
And your language here about transfer of benefits to countries with travel restrictions,
Yes.
it looks like someone first must be found to have been fraudulent and have an intention. This doesn't take someone who happens to be a legitimate child care provider sending money back to parents or something.
No, not at all.
To that end, there's a lot of this, and maybe you went over this earlier, a lot of what the ALA said and the investigator said is fraud is hard to prove in these cases. And so what specifically are you doing to combat that problem?
What's that
Making
problem?
it easier to make the case against fraudulent,
Yeah.
giving investigative powers or giving, proof changes that makes it easier to prove a case on fraud.
Yeah, investigators said a lot of time they thought there was fraud. They took it to prosecutors. Prosecutors said, it's not enough.
Well, and that's,
Yeah, so within the proposal, we take the licensing group and turn those individuals into mandated reporters. So that if licensors see fraud, they need to go ahead and mandate that, that those reports are forwarded back to the CCAP investigators immediately. So if you go to a facility that's saying they take care of 50 children and there's 10 children there, that's a red flag that would need to be reported immediately. The fact that we are closing that window for centers and providers to give access to those attendance records, that makes it much more difficult for individuals to cook the books on the back end. And that was a challenge that investigators said they were having. Bringing back that attestation statement so that individuals, as they sign in, know that if they're signing in fraudulently or not telling the truth when they sign, that they're violating the law. Having that affirmative line right in there, back in there, as it had been previously, that helps narrow that down and lock that down in for charging as well. So there's a lot of things within this bill that provide that ability. Plus, we're hoping that the autonomy side of this really helps investigators focus in and hone in on that waste, fraud, and abuse.
Moving the legislative auditor had suggested moving all the CCAP investigations over to the BCA. And of course, we found out recently that the BCA already has a case management system that DHS doesn't have. So why not just do that?
Yep, and that's one of the proposals that's being floated around. I think there are in some ways where that makes a lot of sense. I had a follow-up meeting with Mr. Nobles in my office about that. One of the things that I think in a perfect world with a totally autonomous Office of Inspector General is that the licensing group and those folks that are going out for licensing inspections, keeping those individuals in very close proximity, a close working relationship with the investigators. In a perfect scenario, you would have those individuals working hand in hand so that as licensing went out, you could identify things that were areas of concern, perhaps provide you enough for information for swearing out search warrants and drafting subpoena language, and having those entities work together in order to crack down on this fraud. Remember that when there was a perfect example of this is when there was issues with bars in downtown Minneapolis several years back around closing time in Block E. It wasn't the police department that ended up shutting down troubled establishments. They worked with Minneapolis Public Health, who followed in and looked at very strict enforcement of liquor law license, and they were able to suspend liquor licenses and work it that way. And so there's multiple ways to approach these daycare centers or providers that aren't acting within the bounds of the law. Part of that is making sure that licensing and investigations work close together. That's why, in my purview, I think it makes a lot of sense to pull the Inspector General's office completely outside and keep that autonomy together.
Can I get a point of clarification here? I had asked you earlier about back billing, and it says here in Article 1, Section 5, that it can be made retroactively from 6 months down to 3 months. So is that correct? Were you perhaps thinking of something else when you said 30 days?
I apologize, 3 months is
It
correct.
is 3 months, okay.
With the OLA is out next month, sometime soon, with its recommendations on what should change, are you willing to commit to us here that if they have recommendations that are specifically at odds with some of these recommendations, that you're willing to pull these back and say, okay, the OLA studied this more, we'll go with them?
Well, we've got to see what the OLA has to report. It would be unfair for us to commit anything that we haven't seen today.
Thanks, guys.